I see a lot of familiar faces, but I see also people that I never met before. So I want to thank all of you, for coming, to our event. For people, who don't know me, my name is Ella, and I'm an office manager in Dr. Gashinsky's practice. I'm also doing the nutritional counseling in our office, and I'm also the one you already heard, who prepare all this, meal for you. And I hope you enjoy it. I'm also Dr. Gashinsky's wife. So
way before I start thinking.
So for both of us, for me and Dr. Gashinsky, holistic approach to life is not just words. We live this way. We brought our kids, raising them, this way. And, we practice, holistic, dentistry here in our office. And a lot of time, people ask me, what does it have to do, with, holistic, you cleaning teeth, you fixing teeth. How, you can, take care of your teeth in a holistic way? My answer usually is everything starts in our body from our mouth. What we eat, and, our teeth, fortunately, are part of it. So understanding that this topic is actually not really well known for public, made us realize that we need to do something about it. And we many years ago we started lecturing and speaking in front of the public and explaining to them what exactly is holistic dentistry, because we've been doing holistic dentistry actually for almost 20 years. We had a small office across the street, and when the time came, to expand, we decided that, when we're going to build the office, we're going to create, the space that is going to be actually big enough, for us, to bring the crowd, bring the public here, and, help them to understand, what exactly we can do for them, and how they can get, healthier and happier, without taking magic pill that usually traditional physicians are giving us, for everything. And that's why we started, bringing holistic physicians and holistic practitioners, to help us, to educate, our patients and public as well. And we're very proud, to be part, of this awareness that is growing, and more and more people actually knowing about holistic approach to life, and they like it, they're very interested about it. So that's why we at least twice a year now we're going to be doing it more, because people asking for more information, for more lectures about holistic approach and wellness, and we're going to bring more holistic practitioners to our lectures. That's why at the end of our event, we're going to be asking your opinion, and we're going to be asking, what exactly would you like, to hear next time? If you have, any topics that you're interested, to know about, we'll be more than happy either cover it now, hopefully, or, in the future. And with this said, then I want to introduce, our first speaker, Dr. Gashinsky. Dr. Gashinsky is a holistic dentist. He's practicing holistic dentistry for more than a decade, obviously. He is the accredited member of International Academy of Oral Medicine and Toxicology, and he's on his way to get the degree, and he's going to be naturopath very soon. Yes. So let me introduce Dr. Gashinsky for people who don't know.
To live up to your expectations. Which is not easy. I'm so glad to see it. Good amount of new people. Wow. Patient existing. Who I know. By the way, when people there, why you don't come here? Just come inside. This is so many places. Come inside. Take a seat. Ladies, gentlemen, take a seat. Sorry, you can go here. Trust me. This is I'm going saga in my office because I like air conditioned work. Really. And ladies want me to be warm, and that is a little bit disagreement. But this is the last one. Thank you for coming here, and I'm very glad to see new faces here, and I'm very glad to see the existing patients and people who I know, alternative practitioners, that trainers, and it's really good to be here. And before I start my presentation, I want to tell you, thank you very much first to my staff. This is a really Fred, you have to help me with this one. That it's on the left button. Okay, left button. Let me do it old-fashioned way.
Genius minds can't do simple tasks, right?
I have no problem with this. Welcome to our event. And as you know that Ella introduced herself as my wife. Been married for a short 38 years. Two little kids, 32 and 37. And that we're dreaming about to become grandparents, but we don't have any power. We have to be patiently waiting. All right. But we have another baby here. This is the office, and this is we have a new big family here. All my staff here, these wonderful people, and it's so big pleasure to work together. I will talk to you about what is holistic dentistry a little bit. I can talk hours because it's my passion, and I'm going to tell you how it changed me as a dentist, because it was a lot of changes. I graduated dental school in Russia over 40 years ago. If somebody want to do the math, it was summer of 1973. And that in Russia, dental school is different. It's 5 years, and it's very intense because government paying for you, and there is no way to goof around. And they taught us dentistry, and they taught a lot of medicine. You couldn't even imagine if I'm going to tell you what we have to go through, and basically we get almost the same knowledge as the medical doctors. We have to go through internal diseases, infectious diseases, basic surgery, because every dentist in Russia is supposed to deliver babies, and we have to go through the training, obstetrician, gynecology, we have to go training through the dermatology, psychiatry, a lot. And basically we knew very well how the body works. In addition to this, dentistry was really just pushed into our head and everywhere, and we taught a lot of things, and we learned dental materials as usual. And something that's really get into my head, that the silver fillings, it's outdated dental material 40 years ago in Russia, and it was very dangerous to work with for the doctor. And later on, I came to the United States. In order for me to practice dentistry here, I have to go to dental school, second time in my life. Here it was much shorter. Instead of 4 years as usual, they allowed me to get this education 3 years. And we learned dentistry on a new basis. And we learned dental material again. And they don't talk about toxicity, they don't talk about allergy. And it kind of surprised me because life has changed. If you look in life, the 40 years ago, you could easily bring the sandwich with a peanut butter in school. Can you do it today? No, because it's dangerous. And that the toxicity bombarding us, and that all allergy just increasing. And you look around, that people just have tons of problems. And nobody talk about toxicity and allergy, and it kind of surprised me. Because that with advanced technology, we can measure how deep it is, how wide it is, how dense it is, and we become engineers, we become technicians, we become craftsmen, and sometimes we become artists when we're doing a frontier. But nobody talk about the healings. Because that everybody in dentistry consider about the teeth, gums, surrounding structure, but nobody even really talking how the body works together. Because teeth is a part of our body. You know, the gums part of our body, and everything interrelated and interdependent. And in holistic dentistry, for me and people who think like me, who just really into this field, for us it's important about the health. How to improve patient health, how to improve the quality of patient's life, and how to just improve longevity. I'm talking about longevity just because we know statistically if people losing teeth, their chances to get a heart attack or stroke increase. And this is a statistic. It's not me who created the story. This is what I learned. And for us, it's very, very important to taking care of the patient, all the way down, you know, the basic stuff. You know that here in this office, we are using a lot of technology, but you know that in order to use a lot of technology, we have to know the basic. And basic to be healer. First rule of healers, do not harm. And do not harm, it means a lot. For us, it means that we have to put something in your mouth that's not harmful for you. And this is, we're using technology for this. We have a special test for you. People who have extensive dentistry, people who has some kind of allergic reaction, people who has, you know, that immune system compromised. We want them to go and have a special test to figure out what material good for you, what is not. And I'll show you something right now. This is Clifford test. And this test, you can get to the hospital, you can get blood drawn, sent to a special lab, and it is tested 6,500 plus dental materials and tell you which materials are suitable for you, which are not. Very accurate test. And I'm not invite everybody who is just healthy, young guy, strong one, just need one feeling to do this test. But somebody who really need extensive work. If your immune system is compromised, this test is very, very important. And this for us it's important because we're not going to put anything harmful in your lungs. And do not harm, it's not only about just putting something in your mouth. I'll show you something. This is slide. Why you should remove and avoid mercury film. I'll explain to you why. Very easy way. You know, silver films, it's 50% mercury. You know, back in Russia, we don't have this technology. It's a new technology, just maybe 25, 30 years old. They figured out how to put the mercury inside of a small piece of plastic, and this is powder of silver, tin, and copper. And mixed together in a special machine, and it comes out to ready to put in place in mouth. And it's very dangerous part for this film. While they just open the capsule, it's a lot of vapor coming out. One that you put in the patient mouth, and it sits there, and this third one that you have to remove. Nothing, unfortunately, in this life forever, except that we love, and they say the implants. You know, this is the silver filling eventually need to be removed. And they need to be removed. They need to be removed in a special way. Everybody. Every dentist on the planet Earth can do silver fillings. Anybody. But when you just remove the silver fillings, you have to ask, is your dentist mercury free or mercury safe? It's not word, it's an idea. Mercury free, it's a dentist who does not place silver fillings. Now it's got 50% of American dentists who don't place silver fillings. But 50 still does. Okay? But mercury safe, this is who gonna take care of these silver fillings in safe way. Because safe way, it includes a lot of work. It will include a lot of isolation, protection, special equipment, and special knowledge. If you look on this patient, you know that how they isolated his mouth, he's breathing through the oxygen from outside source, completely covered. We call this machine an elephant. It's a high quality, high power vacuum, and it takes a lot of effort to remove properly because then you inhale the vapor and the small particles all over your mouth. It's not good, it's not healthy. And that's why, you know, that our office has a whole program that high standard for the amalgam removal protocol, and I'm accredited member, and Dr. Sunny, totally certified in this one. She knows how to do it very well. By the way, she's my dentist. And I know where to go. All right. And you know that this is something new I'm going to talk to you about it. Because dentistry, in reality, it's a very scary stuff. Scary. It's a fear, anxiety. Nobody want to be in the dental chair. Even I don't like to be in the dental chair. It's true. You know that because I know what it is. It's scary and uncomfortable because we are humans. We are. And you know that this machine allowed in a natural way to put you on a stage of pre-sleep. And this is just 4 basic components for this. It's a natural supplement. It's a special acoustic software. It's electrical stimulation, which is used in medicine for over 50 years. And put you in the stage of pre-sleep. Then you, in the stage of pre-sleep, you lay down in the dental chair, you just relaxed. 1 hour appointment going for you like 10 minutes. And I'm not introducing it for you because I love it. I introduce it for you because I cannot live without it. I tried on myself. I was the first patient in this office with this machine. It's great. Every time I go on a very long trip, I have a portable one with me. It just helped me just adjust it to any surrounding, just helped me to relax. I don't feel time spent. And this is very important to us. And this is not only one piece of technology. And this piece of technology introduced to all our patients. You know, the patient who's scared, we have a long procedure, who just need help, we just give them. It's no charge procedure. We just give it to our patient because we want them to have a great experience. We have a lot of advances in technology. For example, we have a microscope here in the office. And this microscope allowed us to check what bacteria live under the gums. And if you look at this one, you know that this is Fran who just studied this bacteria. Okay, and she just going to look at this bacteria. Interesting thing, you know. Hygienist can see this bacteria. Doctor can see this bacteria. Patient himself can see this bacteria. And this has become real stuff. Can you come here? This is perfect stuff.
Don't be shy. It's okay.
Don't be shy. Come inside.
There's a space there.
There's a space there. Okay. And when we evaluate this bacteria, we want to know what it is here. Is it friends or no? Because if it's friends, we're just happy for you. If it's some kind of a very active bad guys, we have to just evaluate this and decide how we can help you to get rid of this. And we're not going to put you on antibiotics. No. We're going to put you on the supplements. And I'm going to put you on the same supplements I used to take myself. Because I was first one to check my material. And you know, that I find some not very good guys who work with my friends. And I get rid of those. And we're going to help you to get rid of this infection. Because these bacteria sit underneath the gum, associated with gum disease, and might get into your bloodstream. And get in the bloodstream and might get to your heart. And when talking about bacterial endocarditis, dangerous condition that people get to the hospital, and some are dying from this, it's a serious condition. I'm not worried about it. It's not I'm going to talk without it.
What happened?
I don't know. Something.
It's Mercury in retrograde. I said it is.
It's all right. You can fix it. I'll go.
Okay.
All right? And supplements, it's not only one thing that we're using to treat the gum disease. Because gum disease is widespread. And we don't want to treat the gum disease with antibiotics. We don't want to treat the gum disease with surgery. We're going to treat the gum disease with supplements. We're going to treat the gum disease with ozone. And what is ozone? This is supercharged oxygen. We have a machine in the office that create medical grade ozone. Medical grade ozone is unbelievable thing. Okay? Unbelievable thing. medical grade ozone, it kills bacteria, viruses, parasites, even fungi. It helps rejuvenate the body and make you stronger and improve your immune system. We're using it a lot. Not only for the gum disease, for a lot of different procedures, but this is absolutely different topic. It's going to take me hours. But for the gum disease, we're using this very, very successfully. In addition to this, we're using another technology. We're using lasers. And depending on the patient's situation, we have a different type of lasers. And we have everything available for you because your health is important to us. Okay? You ready? We need to move to the next topic.
Go ahead, keep going. There you go. Take a minute, so.
Take a minute.
Yep.
Wow, it's my PowerPoint.
Gotta love technology. Technology.
Do you take the supplements way before the surgery or at the same time?
We discuss everything with you specifically. You know that we have a protocol for different conditions. Everyone is different. And the supplements are different for every condition. Every bacteria need to have a certain approach. It's a very, very scientific and a very crude approach. Because we're checking it on a regular basis. Patient coming and we're going to check bacteria again and again and again. All right?
A question for you.
Yeah, you good.
Okay, I just don't want to miss the slides.
There's a question back here. The question for you about the ozone.
Yeah.
Is it, were you referring to treating the air or the water or both?
Okay. Ozone, it's a big topic, but I'm going to give you a little bit short inside. In this office, we use ozone as a water, ozonated water. We're using as a gas in two different modalities. One for the gases for the gum disease treatment, another modality which is much more stronger. This is for infection, real big infection. After extraction, before placing implants, I do an injection with ozone underneath of the gum. And it sounds maybe scary, but I believe in this technology. I go to the very specific doctor using ozone as IV. And if anybody gonna tell you I'm going to die from the embolism, don't try. You know, I'm still alive and using it. All right? Yeah. As I talked to you about the ozone and mentioned everything about it, we're going to talk about something else we use here. You know that I like to learn. I really love to learn. And everything I can just get my hands on and time available, I learn. You know that I'm very fortunate to learn new technology and very successfully introduced for our patient. It's a pinhole gum rejuvenation. You know, that is an unbelievable procedure, and I'm going to show you the short video. And the short video is going to be very, very interesting for you, very educational.
The gum is then cut over the area of recession.
Okay, this is recession area.
The tissue for the palate is placed over the recessionalized gums. Once complete, cut sutures pull around rather than now with a new revolutionary channel gum rejuvenation. The gum recession is corrected without cutting more stitches. Instantly, this new process begins with a tiny nutrient that is made in the gum. Then, a special dental instrument is placed through the pinhole to fit the gums with gentle movements. Once free, the gums are guided down into a healthy position. When the recessed gums are corrected, tiny collagen strips are placed inside to help stabilize the gums. Incredibly, the pinhole heals rather quickly and often overnight. When complete, the receding gums are corrected with a minimally invasive treatment that is quick, easy, and instantly pleasing.
I've done tons of those surgeries way before, with a lot of stitches and everything else, and quite successful. And then I was invited on Channel 12 to talk about pinhole gum rejuvenation a few years ago. You know, that it was a reaction of the people who just recording this. cannot be not painful. And it was just inside of me just saying, yes, it's not painful. It's a little bit uncomfortable, but it's not painful. It's unbelievable technology, and the guy who developed this technology is genius. And he trained people by hands. He trained just a very small amount of people, personal, very personal training. And it's a great technology, and I really love to do it. And I'm going to give you an example. I have a patient that had done this procedure. 6 months later, when we're going to do another side. Who won a torch? But if a patient, she wanted another side to be fixed. You know, this is the people that we're talking about, and this is the results we're talking about. This is new technology. You know, that with the technology, it's interesting thing. I'm going to just go a little bit different way. Technology, it's become just so widespread, and we just start losing connection with the people. You know, the machine, measure. We have to get connection with the people here. And holistic, it's about the whole body, whole thing, and to see the person in front of you. For me, I want to see the person in front of you. And I'm quite open-minded, and I talk to everyone, and I joke with everyone. And this is something that I want to just mention very shortly because it's another 2 hours discussion. This is every tooth in your body connected to the certain organ. If the tooth is not healthy, it's affecting life. It is. Every time you come in here and we see infection around a certain teeth, we talk to you about it. We just pointed to you and just really we have a conversation. What to do about this condition? Are we going to keep it here? Are we going to remove it? How are we going to deal with it? You know, it's very, very important to us to just really educate. It's a big, big topic. And it's interesting thing, you know, that we're going to talk later on, you know, that patient coming in and they coming into here to be healthy. For me as a holistic dentist, healthy teeth, healthy gum, healthy body, it's a dream. I love patients who's coming here, have no problems. It's my dream. But if something needs to be restored, everything that restored in your mouth is metal free. Everything is a metal free. We don't want to have any metal in your mouth for many reasons. And if you look at this, this is the titanium implant. And I'm going to show you the new advance in technology. It's zirconium, non-metallic. And I placed in those people for quite a long time, since it was introduced in the United States. And I see few patients sitting here who has those implants in their mouth. Yeah, they do. You know, zirconium implants, and they're white, and they're non-metallic, and they're non-toxic. It's really great material, and I love to place it because the results is unbelievable. I'm going to talk about
Somebody's familiar.
Before I'm going to show you a video, I'm going to talk to you, all of you, what make me run. I see it what make me run.
How they didn't know you were going to do it.
If you don't want it, you're going to just go to
Don't worry, she signed her lease. She signed her lease.
What make me run, this is how the patient feel about themselves after work is done. You know, I'm going to give you a few examples. You know, the example that I have a patient this Monday. He came here 5-6 years ago, totally not holistic. He was dragged here by his wife. Because wife making the medical decisions. This is basically true. Basically, women making her health decision. And he was dragged here, and you know, he was big non-believer. And on Monday, I removed his last silver filling 3 weeks before this Monday, and he came in and he said, "How are you feeling?" And he looked at me, "Dr. Gashinsky, you could not believe to me. You know that it's like, you know, that fog was lifted from my brain. I can see everything. I can see the trees, cars, people. I can see life around. And this is really unbelievable thing. You know that I have a patient who told me after all silver fillings removed, it's she can read, understand, and remember 3 pages. And before she could not. You know, when remove infected tooth, and somebody gonna tell me, somebody's here probably, and they tell me that they can breathe better. You know, somehow they want to just go to the chiropractor and fix their chest, and now they can breathe better. And this is not because me. I just do a little bit small piece. Because infection and toxicity multi-layer. If there's a layer in your teeth and the gums, it's very easy to lift it. If it's something else, they need additional help with additional professionals, and they need much more efforts. And now we're going to play this testimony. I take too much time.
So where do I begin to talk about this amazing dental practice? From the state-of-the-art facilities to the warmth of the staff, this practice has something for everybody. For the person who does not really want to know too much about what's going on, they just want to be comfortable and have it taken care of, you've got it here. For the person who's really eager to find out more information, what is the root of, no pun intended, what is the root of my problem? What more can I do to prevent this problem from coming back? You get the information here. So Dr. G's practice has something for everybody. You'll be totally satisfied. They go out of their way to make you feel comfortable in the chair, relaxed in the chair, and you have the gold standard.
Thank you. And I want to invite everyone, just join our dental family. Come here, experience yourself, find out what you like, and just tell us what you want, and we're going to try to work with you as much as possible. Also, I'm just going to introduce you a few more staff members, Dr. Sani, Tatiana, friend. They're going to be downstairs, and we're going to answer your questions if we can do it today in a short period of time. But if you want to just consultation here, just schedule consultation. We'll talk to you, and we'll just help you to find out what the problem is, if any. If it's not a problem, we're just going to keep you healthy. All right? Thank you very much, folks.